But since it's a QR code, you can let them open on the screen, and then as you're seeing on the screen, you will have a separate page just for type 1 diabetes. Once you click on the type 1 diabetes, it takes you to all the resources which are available for type 1 diabetes. And then when you look at SAC-Kit Wellness, that gives all the resources for type 2 diabetes. The rest of the website gives a lot of general information about precocious puberty, where our offices, so on and so forth. All the rest are arranged, but these two entities being such important things for us, we have more resources and in one single page with several links to them. When we go to the type 1 diabetes page, we will also see that we have videos available. We have a separate YouTube channel called SAC-Kit. Everything I've done is SAC-Kit, like Sacramento Kit. I don't know how I came with that name, but that's what it is. So it's called SAC-Kit Info. So SAC-Kit Info has a resource. Nothing is opening on the screen.
I know, I'm sorry, hold on.
That's okay.
Could you,
SAC-Kit Info channel has type 1 diabetes, precocious puberty, growth, thyroid, bilingual, English and Spanish. And then most of, in the first page on the top left, you will see Google Translate. So pretty much you can translate majority of the site content to whatever language. Now we are seeing a lot more Arabic speaking patients. We are seeing this Pashto speaking people from Afghanistan. So luckily we have those resources. Not everything gets converted, but majority will get converted. For Spanish, I've created separate material for all of those things. So typically what we do with a type 1 diabetes patient is when they come over to the office, the first visit is always with me. It's called the coach visit. During the coach visit, I do a PowerPoint presentation for my type 1 patients. Now I'm doing that for type 2 as well. It's a 1-hour appointment with me to tell them what to expect about their journey along with us for the next several years. What is Penn's team? What is this? When do they get pumped? When do they get glucose sensors? What does it mean keeping up with the appointment? When will we kick them out of the practice? What is required of them? So on and so forth. Split families, we set the rules on the very first day. These are the requirements if the families are split. We are not going to be your social power trying to connect both families, but we are more about facilitating your child. Other partner can always be on the video or come in person. We are not going to be calling and letting them know how things are, so on and so forth. So the coach visits are set up. There are 3 coach visits within the first 60 days. The first visit is with me, and subsequent visits are with one of our members. In the past, I used to see a whole lot of patients consistently over a period of time. As I've gone older, I'm only getting to see the new patients, and then somebody else takes over after that. We are about 9 providers in the office now. So with the volume, I can't see all the follow-up patients as well. My old follow-ups are still with me. For the type 2 patients, which the numbers are increasing now, the SAC-Kit Wellness is the resource which is online. And SAC-Kit Wellness, there's a lot of useful information, but the idea is to limit it to 5 minutes or less for them to look at it. Whatever is available, everything is available in Spanish simultaneously. And then if they really want to go for a course, then I have a 6-month course available. Each course is subdivided into week by week, and they have workbook, so on and so forth, but it's a self-motivated pathway during that period with periodic meetings with us. Like any type 2 programs, healthy lifestyle is still a touch and go. Unless and otherwise we develop an incentive, there's no way we can do anything with that. Coming back to our type 1 resources, don't bother now, they all have
I know, they all have it.
So with our type 1 resources, the resources available on the page talks about California Children's Services, Penn's team, what are the different kinds of pumps available, what kind of insulins are available, because in the hospital we are always start on one insulin, but subsequently the insurance might define what they can actually use, the type of insulin, what is continuous glucose monitoring, And as far as the Facebook support groups, we have more than 1,000 patients on our support group. We have little kids group and older kids group for the parents to interact. I learn a lot from what other people talk, because social aspect of diabetes is so much, so they have to continue to learn that. We also have resources for sick day management. What do they do for sick day management? We have materials for them to prepare for school materials, so on and so forth. Now, school forms is something you will hear. Now we have developed new ways where before the patient shows up the first appointment, we send a text with a link where they can fill up a lot of information. So when they come back to the office, the school form will be almost ready, where we have to just fill up the blanks, sign, and give it away. So the first appointment, they'll get all their supplies and school forms and everything set up. So we've developed quite a bit of systems. So what we are seeing with this resources, both on-site and off-site, is our number of patient calls which comes in has decreased, and you will also see readmission of our patients are very less. There are 5 or 6 people who will keep coming back again and again, but in general, you will see our readmission rates are low. So I'm continuing to expand more and more resources for these patients as time goes by. Hopefully it will be good. That's all I have. 10 minutes.
Are you finding there's anything missing component from when they leave the hospital that we can?
My type 1 patients are fine. The type 2 is not because we are not doing something right. We are finding that type 2 in adults is so different from type 2 in children. So type 2 in adults slowly progresses to becoming bad. Type 2 in children, it starts bad, and then they dramatically improve within the next 2 months. So the the hemoglobin A1C drops down beautifully. We are able to withdraw all the medicine, and then they forget. They don't worry about anything at all. In about 2 years, it comes back very aggressively, and then it becomes really difficult to treat. By the time the patient is defiant, socioeconomic crisis with the families. So we don't know how to handle that, but again, that's not a hospital-based problem. Public health resources are very less. Type 2 diabetes, you need public health. And schools don't have the interest. There's so much money available for diabetes, it gets diverted for other things. Advocacy in the country, in the state, is not there. So that's why there's a problem.
Are your websites, are the educators using that?
Yeah, educators have resources. All patients, the educators give the website to the patients too. With all these things, by the time they come to the office for the first time, less than 50% of the patients have actually gone to the website even once. Anything which is free in this country, they think it's not useful. So that's the problem. So there's some way we collect like $5 thing and then give it back to them. I've heard about all those ideas, like apps where you collect money and then give back. But to design all those things is so much more expensive. Like for the coach visits, I thought if I could demonstrate, I collect $25 from these patients and 3 visits are over, and then they've done 100% well, the money goes back to the child, something like that. But to design something like that costs thousands of dollars. I mean, everything I've designed so far is all, I code everything. I go read and I code, so I don't pay anybody to design. So that's why it's not that good. It's okay, but it gives the information. If I'm trying to put a cost on all these things, I had gone to people, they're quoting me anywhere between $100,000 to $150,000 to create a good website where there is no, I mean, if I go to the hospital, I've done that all, like given up on all those things. To cross from A to B, it is so difficult. I have to go through so many layers. So whatever I have is what I have. So, I mean, it's okay. It's better than any other resource in the country. You can actually go to Johns Hopkins, Denver Children's, Barbara Davis. Nobody has this comprehensive website, and then nobody has this much information in one single place. And many of these places, when I go give lectures on how to do the continuum, they say, okay, how big a team is, and I say, this is the team. They are not able to believe it. So,
And so you're good with us sharing, introducing the website
Yes.
to.
Yes, and if
families
you guys give me any ideas, right, Prakash, put this or do that. If I'm able to do it, I'll do it. Yeah, right now my staff always come and give advice or whatever they do whenever I get time.
Yeah, yeah. And just so everyone knows, the QR codes for these sites are on our SharePoint, so you can always show that screen or print it out for them as well.
So typically our patients should not be too much of a headache for you as far as how it is structured. Our inpatient team as well, they're Sarah Boyd and group, they're amazing people. And outpatient Rosanna's team is very good, and probably many of you know Rosanna was a floor nurse before she took over. And she was 29 when I first spotted her. I had just come into town. I was also very young in town at the time. Actually, I didn't notice that she had a ring on her hand. I tried to set her up with my friend of mine, and then she said, "Prakash, if there's a ring, it means I'm married, so you can't set me up." So, anyway, her husband, whenever he meets me, he always said, "Prakash, you try to give away my wife." Thank you for having me.
Yes, thank you very much for taking us
Thank
to
you.
Yeah.
Thank you.
Always good seeing you.